There is a question that many men, especially after the age of 60 or 65, quietly ask themselves. It is a doubt that often causes embarrassment, to the point where it's not even brought up with a trusted healthcare professional. The question is simple, yet loaded with uncertainty. Can what I do in my intimate life affect my health? Is having sex or masturbating frequently beneficial or harmful? And, even more importantly, could this have any connection to prostate cancer? This is a subject that, because it is so intimate, ends up surrounded by myths and fears. But the truth is that what happens in the privacy of the bedroom can indeed have a direct impact on both the quality and the length of one's life. That's why it's essential to address the topic without taboos and based on what science has already discovered. To understand this impact, it's important to know more about the protagonist of this story, the prostate. It's a small gland, about the size of a walnut, located just below the bladder. Its main function is to produce a fundamental part of semen, the so-called prostatic fluid. This fluid is not just an add-on, but a true nutritional cocktail that contains zinc, citric acid, and vital enzymes to protect and transport sperm cells. But semen production is a team effort. The seminal vesicles are responsible for providing most of the volume, a sugar-rich fluid that gives energy to the sperm. The testicles, in turn, produce a smaller portion of this volume, but the most important part, the sperm cells themselves. All of this content mixes to form semen. The process of expelling this fluid from the body is fascinating and occurs in two phases. First comes the emission phase, when all these fluids gather in the urethra, ready to be released, like actors waiting behind the curtain before stepping on stage. Then, with proper stimulation, comes the expulsion phase, during which the pelvic floor muscles contract forcefully, propelling the semen out of the body. This process depends on perfect communication between nerves and muscles. When conditions such as diabetes or certain surgical procedures affect this communication, the process can be altered. A very common question among men is whether holding back ejaculation can be harmful. There is no scientific evidence that refraining from ejaculating directly causes a serious disease, but that doesn't mean it's without consequences. It's like imagining a river that stops flowing. The water accumulates and loses quality. Something similar can happen with the prostate. In cases of chronic prostatitis, a persistent and sometimes painful inflammation of this gland, a low frequency of ejaculation can worsen pelvic discomfort. Studies suggest that increasing frequency, whether through sexual intercourse or masturbation, can help relieve these symptoms, acting as a sort of internal canal cleansing, reducing pressure and inflammation. Another lesser-known benefit concerns sleep. Ejaculation releases substances such as prolactin and oxytocin, hormones that promote relaxation and help the body fall asleep. A study published in 2023 in the scientific journal Sleep Disorders showed that sexual activity culminating in orgasm significantly improved not only the ease of falling asleep but also overall sleep quality. In other words, beyond pleasure, maintaining an active sex life can be one of the most natural ways to improve rest. Given this, the question many want answered arises: does ejaculating infrequently increase the risk of prostate cancer? Or, on the contrary, does ejaculating more often help protect this gland? This is a question science has been investigating for decades and, as we will see, the answers are surprising. To answer whether ejaculation frequency can really influence the risk of prostate cancer, we need to look at the most reliable studies on the subject. One of the best-known studies was conducted by Harvard University and followed more than 30,000 men over the course of 18 years. The result drew attention. Those who reported ejaculating more frequently, an average of 21 times per month, had about a 20% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times in the same period. But how is this possible? The most widely accepted explanation is that regular ejaculation helps to flush the male reproductive system, eliminating potentially harmful substances that, over time, could irritate or inflame the prostate. It's like periodic maintenance to keep the system clean and functioning well. In addition, there is a hormonal aspect involved. The prostate is sensitive to the action of testosterone and its derivatives. A regular frequency of ejaculation can help maintain hormonal balance and reduce excessive stimulation that may encourage cellular changes. While it is not an absolute guarantee against the disease, it is a simple habit that, according to the evidence, offers clear benefits for men's health. Of course, each person's sex life is influenced by various factors. age, health status, the presence of a partner, level of desire, and even emotional issues. There is no magic number that works for everyone. The important thing is to understand that, whenever possible, maintaining sexual activity, whether through intercourse or masturbation, can be a natural way to take care of the prostate. On the other hand, it is essential to remember that prostate cancer is a multifactorial disease. This means its origin is linked to a combination of genetic, hormonal, and environmental factors. Having an active sex life helps, but it does not replace other preventive measures, such as maintaining a balanced diet, exercising regularly, and undergoing routine screenings. Prevention means looking at the body as a whole. For example, maintaining a healthy weight reduces systemic inflammation and helps control hormones that, in excess, may stimulate the growth of prostate cells. Likewise, avoiding the excessive consumption of processed meats, fried foods, and alcohol benefits not only prostate health but overall well-being. Another important point is mental health. Chronic stress directly affects the immune system and can negatively impact sexual function, reducing desire and the frequency of sexual activity. That's why practices such as meditation, relaxing hobbies, and quality time with loved ones also play a role in protecting the prostate. Even with all this information, many people are still reluctant to talk about the subject. Shame, taboos, and fear of judgment cause important questions to go unanswered. The result: men ignoring symptoms such as pain, difficulty urinating, or blood in the semen, and failing to seek medical help at the right time. It is crucial to break this silence and understand that caring for sexual health is caring for overall health. Now that we understand how ejaculation frequency can influence prostate health and even help prevent cancer, it's time to look at another equally important point: the warning signs that indicate when something may not be right. Recognizing them early can make all the difference in treatment success and in preserving quality of life. Identifying the early signs of prostate problems is one of the most effective ways to avoid serious complications. The major challenge is that, in the early stages, many changes do not cause pain or obvious symptoms. This is why so many people only discover the disease when it is already at a more advanced stage. However, there are subtle changes in the body that can serve as warning signs, and ignoring them can be costly to your health. One of the first symptoms that deserves attention is a change in urinary flow. If you suddenly notice that the stream has become weaker, that it takes longer to start urinating, or that you have to strain to empty your bladder, it's time to investigate. These changes may be related to a benign enlargement of the prostate, but they can also indicate inflammation or even the presence of tumors. Another common sign is the need to urinate more frequently, especially at night. Getting up several times to go to the bathroom may seem like just a consequence of age or fluid intake before bed, but when this becomes constant, it's worth seeking a medical evaluation. This symptom, known as nocturia, may be related to an increase in prostate size, which compresses the urethra and makes it harder for urine to pass. The presence of blood in the urine or semen should also never be ignored. While it may have other causes, such as infections or small injuries, it is a sign that requires immediate investigation. It is always better to rule out serious problems than to risk discovering them too late. Pain or discomfort in the pelvic area, lower back, or legs may also be associated with prostate complications. In more advanced cases, when metastasis occurs, the pain can spread to the bones, compromising mobility and quality of life. That's why early diagnosis is essential to prevent the disease from progressing to this stage. In addition to watching for symptoms, prevention necessarily involves routine screening. The PSA test, prostate-specific antigen, and the digital rectal exam remain the most important tools for detecting prostate changes. Even without symptoms, men aged 50 and over, or from age 45 if there is a family history of prostate cancer, should include these evaluations in their annual health checkups. And here's a crucial point: early detection saves lives. When prostate cancer is identified in its early stages, the chances of successful treatment can exceed 90%. This means more years of life, better quality of those years, and less suffering for the patient and their family. To complement this protection, maintaining healthy lifestyle habits is essential. A diet rich in vegetables, fruits, legumes, seeds, and nuts provides antioxidants that fight free radicals, molecules that damage cells and increase cancer risk. Regular physical activity helps maintain hormonal balance, reduces inflammation, and strengthens the immune system. And never forget the importance of hydration. Drinking water throughout the day supports the proper functioning of the urinary system, prevents toxin buildup, and helps reduce the risk of infections that can worsen prostate problems. Small daily changes, when done consistently, accumulate into significant benefits over the years. Taking care of the prostate is not just about avoiding cancer. It's about ensuring more energy, well-being, and independence to live life to the fullest. By recognizing the signs, keeping up with regular screenings, and adopting healthy habits, you will not only be protecting your health but also investing in your future quality of life.